International migration has brought great change to the urban populations of the developed world. In the last 30 years, the UK population, especially in London and other large cities, has become increasingly ethnically and linguistically diverse. In London alone, there are 300 different language communities. Many people speaking these languages are unable to communicate in English. For the non-English speaker, a visit to the local GP surgery is often a daunting and frustrating process. A professional interpreter may not be available or might have to be arranged days in advance. At the Broadwater Farm Health Centre in Haringey, a unique project is taking place using Tamberg 1000 videoconferencing units. They connect the consulting room with Turkish interpreters based at a local hospital. Contact takes a few seconds. Compact enough to fit easily on a crowded GP desk, which already contains a computer and printer, both patient and doctor have a clear view of the face of the interpreter.
Good morning, Foya.
Good morning, Dr. Jones.
Foya, the Turkish interpreter, sitting at her Tamberg 1000, 2 miles away, has a clear view via an ISDN line of both the patient and Dr. Jones, the general practitioner.
Why she's come to see me today.
Merhaba Arzu Hanım.
Merhabalar.
Ben sizin bugünkü ben sizin tercümanınızım, ismim Fulya. Yeni sistemimiz video konferans sistemi deniyor buna.
Video conferencing of this sound and picture quality can overcome the language barrier between health professional and non-English speaking patient as effectively as face-to-face interpreting.
Foya, there seems to be some confusion about the medication. Can you ask Arzu what she thinks she should be taking at the moment?
Arzu, şu anda ilaçlarını nasıl kullandığını Dr. Jones'a bir gösterebilir misin?
Tabii.
Yanında mı ilaçları?
Tabii, ilaçlar yanımda. Getirdim.
Hı.
Geldiğimde doktor bana demişti, bu 2 ilacı vermişti.
The virtually instantaneous availability of a video interpreter has meant that Turkish-speaking patients in this Haringey practice no longer need to ask friends and relatives to act as informal interpreters.
You told her one of them is to be taken once a day, the other one is twice a day.
Okay. Yes, I mean, she's actually got that right.
We wanted a system that was easy to use, and one of our previous experiences using a webcam and a conventional video conferencing system using an ISDN connection was that it wasn't easy to use. It needed quite a complex log-on process. So we looked for reliability and ease of use. We also wanted a system that was not bulky on doctors' desks. Doctors' desks very often have a computer, a printer, books, blood pressure monitoring equipment. All this sort of thing takes up space. We wanted something which had a big enough picture but didn't take up a great deal of space. The advantage of the Tamberg system is that it has a good clear screen, but it's actually only 1 to 2 inches thick. It doesn't generate a lot of heat and it doesn't take up a lot of space. We found the Tamberg 1000 to be very reliable. We've used it now for nearly a year, 5 days a week, many times in the course of the day, and on no occasions has it failed to make a connection via the ISDN link. The sound quality and the picture quality have been superb, and it's extremely robust and simple to switch on and use.
Great. Could you ask Arzu to make an appointment to see me in a month's time?
Of course. Çıkarken resepsiyondan bir ay sonraya bir randevu yapabilir misiniz?
Foya has found that the experience of interpreting via the Tamberg system compares well with her previous work as a face-to-face interpreter.
I believe video conferencing has got all the advantages of face-to-face interpreting, but yet it is less overpowering to the patient because you're not physically in the same room. It puts the patient at ease. Telephone interpreting is very mechanical. You cannot see the body language, especially when the mental health issues raised. It is very important for an interpreter to see the patient and the body language, because when the silence is needed, you need to use the silence, which you cannot do it over the phone because basically you can't see what the patient is doing. And also you can not show your empathy and you cannot intervene. So I believe, again, you can do all these things with the video conferencing.
Dr. Jones predicts a huge expansion in the use of video conferencing to provide interpreting.
I'm very excited by the potential of this technology. Our research pilot indicates that patients are very satisfied and happy to use video conferencing when they don't speak English in the consultation. And I'm sure that the time and money spent on booking an interpreter, waiting a day or two until they're available in primary care, will be much better spent on a high-quality video link, such as the Tambo 1000. In 3 years' time, this kind of technology is going to be widespread in primary care, particularly in practices with large numbers of non-English speaking patients. We looked very carefully at alternative systems before we decided to buy the Tambo 1000 for this project. And I'm sure that the Tambo 1000 is the best available choice to do this job in this context at this time.